Hello, and I am so glad to be starting part two of this live message um, on the topic of communication. And for part two, we are going to be discussing speech impairments and other variations of with speech impairments and how the individual has to deal with the internal battle with the frustration and the mental impact that it causes to the person, and how important it is for the family and people in the close friends, uh, how they can learn and know how to give support and encouragement to that individual. Also, I'm going to be talking about self talk and positive and negative thinking. I did do a lot of research on different variations of speech impairments, and I am just really looking forward on this next step on our journey of becoming aware of different variations of communication. So, without further ado, I would like to begin this part two message. I'm thinking for part three to give you a little bit of a insight of what I'm thinking as we move forward is I think I'm going to focus on the next step on what we say, the power of our words, and what we speak over ourselves, what we feed ourselves by our repetitive talk. So that's just a little insight of where I'm going. I mean, we are going to be really, and then I know for a future one, I would like to touch a little bit on, instead of saying I'm sorry all the time, because especially women, we kind of get trained to apologize, always being sorry. And one thing that I learned in PHP is, instead of saying sorry, say thank you. Thank you for your patience. Thank you for your understanding. So that is another form of communication. My head just has all of these different thoughts that get overlooked regarding communication, and how we kind of get ensnared and in entrapment of habits like over apologizing and getting stuck in our thoughts in the stinking thinking. And so, yes, this is a uh, this is kind of a tender topic for me. I would like to start with talking about the personal mental challenge from having a speech impediment. At three different points in my life, I was inflicted with speech impairments. Why am I adding to this part two message? Positive and negative thinking. When you are going through a period of time of speech impairment, or after a severe medical crisis like a stroke, where there's a chance that the speech impairment could be permanent, whichever the circumstance may be, the individual who is going through that challenge, there is a lot of time spent inside your head. There are a lot of mixed emotions: frustration, helplessness, inadequacy, anger, depression. And that is why the other part of this message is on thoughts. I also feel very strong to address the family members or close friends, because there are challenges. And if you want to be a positive support person of your loved one, gaining insight, awareness, and understanding can be most beneficial. There are various conditions that affect a person's ability to produce or use speech sounds correctly. Articulation disorder. That is, difficulty producing specific speech sounds due to incorrect placement or movement of the tongue, lips, or teeth. Examples would be lisping, substituting sounds, omitting sounds. And then fluency disorders. Those are disruptions in the rhythm and flow of speech. Examples would be stuttering, cluttering, prolonging sounds. And then phonological disorders. Those are difficulty using speech sounds in a systematic and rule based manner. Examples substituting sounds T for K, omitting final consonants. Motor speech disorders, those are impairments in the muscles used for speech production. Examples dysarthria, weak or uncoordinated muscles, apraxia of speech, difficulty planning and coordinating speech movements, voice disorders, language disorders, aphasia, difficulty understanding or using language, orofacial myofunctional disorders, those are problems with tongue posture or lip movements. And then hearing impairments can affect speech development and pronunciation. It is important to note that speech impediments can occur at any age and may be caused by a variety of factors, including genetic predisposition, neurological conditions, developmental delays, and environmental factors. Speech impediments can significantly impact mental health, leading to issues like anxiety, depression, social withdrawal, shame, and low self esteem. These negative feelings often stem from communication challenges that make it difficult to express oneself, which generally leads to frustration and potential social isolation. Common mental and emotional effects, anxiety and depression. Difficulty communicating can cause heightened anxiety and lead to feelings of sadness and hopelessness, which increases the risk for depression. Low self esteem and confidence. Individuals may feel different from peers, which again leads to a lack of self confidence and self worth. Shame and embarrassment. The inability to communicate clearly can result in feelings of shame and embarrassment in social situations. Social withdrawal and isolation. To avoid potential ridicule or difficulty, individuals may avoid social activities and interactions, leading to loneliness and isolation. The impact on daily life. Impact of speech and communication on mental health, anxiety, and social withdrawal. Impaired communication can lead to frustration, low self esteem, embarrassment, and social withdrawal, significantly impacting mental health. The black hole gets deeper and greater becomes the mental imprisonment. With both of my mental neurological breakdowns where my speech impediment returned, in both cases it was because there was compounded trauma on top of trauma, which happened back to back. My brain never got a chance to mend in between the traumatic incidences, which then caused the neurological shutdown. I call it I fried a microchip. So, in this case, for helping my specific speech impediment, I needed mental and emotional rest. Social and academic struggles. Difficulty with participating in class, work, answering questions, or reading aloud can hinder academic success. Professional setbacks. Individuals may face negative employment outcomes with limited opportunities for advancement or promotion. Relationship difficulties. Communication challenges can make it challenging to build and maintain meaningful relationships. I think of the example of my mom during the year of having the deep brain stimulator. It affected my mom's speech, which for my mom, she expressed how she didn't even want to talk. Many years ago, I had this surgery for sleep apnea. I call it roto-rootering, where they just kind of take everything out. Well, the ear, nose, and throat doctor mentioned an additional procedure she could do that would also be helpful. It's called a tongue-based reduction. This tongue-based reduction, it's a laser that gets the back of your tongue, and as the scar tissue goes, it's supposed to shrink the back of your tongue, causing better airflow for communication and for your sleep, which would be opening your airways. For me, my tongue was impaired. I still have nerve that's just off on my one side of my face going down my neck, and I I had to carry a rag with me all the time because I couldn't control my saliva and my communication. I guess I kind of am reminded of someone who is deaf and they learn how to talk. What was really hard with that situation and that scenario is that I heard how I should sound in my head, but when I opened my mouth to speak, it came out totally different, and that was very frustrating. So, uh, it really was a horrible recuperation. I had uncontrollable saliva. Now I got to catch up. I kind of went ahead of myself, but it really was horrible. The anxiety that it caused, it really was very debilitating, which now would be a good time to address family members or people who are close friends to someone with a speech impairment. If you are a loved one or close to someone who struggles with isolation, ruminating thoughts, which can happen for many reasons, including frustrations, helplessness from a speech impairment. If you feel at your wits' end because you don't know how to support or give encouragement to your loved one with this mental challenge, I will give one tip. A person with this challenge wants to feel validated, understood, still worthwhile, and important. A little bit of patience goes, gentleness, empathy goes a long way. When talking about validation, validating someone shows them that you understand their feelings and point of view. It establishes trust, helping the other person feel supported and open to discussing solutions. How can you offer validation? Give them your full attention. Make eye contact and not appropriately saying, while showing interest. Reflect what you have heard by restating their message, such as, it sounds like you feel worse about this situation today than yesterday. Verbalize the unspoken, such as, I hear that you feel like you're unable to express yourself, or it sounds like you are frustrated. Give it time to work. Be sure to let the validation sink in before attempting to problem solve. Here's some other example phrases that can be helpful. I hear that this is important to you. I can see how this has been so upsetting, difficult, and scary for you. I hear that you don't feel respected. It is so hard to feel helpless. With having history of being the individual with the speech impairment, mental health challenges, and also using the example of my mom's speech impairment during her first year of having the DBS, everything that I just noted, the frustrations and anxieties, while struggling with their communication challenges, they are all true, which is why I wanted to address the family members or those who are in the close circle. As frustrating as it may be to you, the listener, it is equally or even more frustrating for the communicator. I think of an example of dealing with someone who struggles with dementia from Alzheimer's, and that person repeats themselves a lot. And you, being the family member or close friend, even the staff member, you probably answer their repeated questions over and over, and you're tempted to become impatient or frustrated with their repetitiveness. But regardless of your internal feelings, you proceed acting like it's the first time the question was asked, even though it is possibly the fifth time or more. Does it get repetitive? Absolutely. But the key in this example is to have patience and recognize it is not their fault that they cannot remember. Common humanity would be helpful in that situation. A- After I had my knee replacement in August of 2024, I had a fluke of an incident which had no medical explanation, and what reason I suspected no medical professional would admit. My left vocal cord became paralyzed, which significantly affected every part of my speech. One thing that was hard about that, where I currently live, is with older individuals, and some of them struggle with being hard of hearing. Well, with my normal voice, I have no problems with being heard. I kind of call it, I got the sergeant voice from my dad. I have a loud voice. And so when communicating with an individual who is hard of hearing, normally that would not be a problem for me. But after this happened, it took so much air to press out a sound. And so it was very frustrating. And the thing was, after I had my knee replacement and I was in the hospital, and before it happened, I had a normal voice. But after the surgery, I couldn't even get out hardly sounds. I had to push with so much effort to get a sound out. But the nurses nor the surgeon even brought up of how it seemed like I was struggling with my voice. It was after I was discharged and I had uh, allergic reaction to something. My whole leg felt like acid was being poured on it. I don't want to get off the subject too much, but I am coming to a certain point. So when I was discharged the first time, even though I was in the hospital for 2 weeks after the knee replacement, I got discharged, and that same afternoon, I went right back to the emergency room. My surgeon was saying that I had an infection, but the emergency room doctor took a look at my leg and he was like, "Man, you're having an allergic reaction." And then I got admitted again. It was that emergency room doctor that actually, when I talk about validating, that emergency room doctor, oh, Bartonelli, I think was his name, Hibbing, Fairview Medical Emergency Room Doctor, Dr. Bartonelli, I think that's his name. He was awesome. He got the ear, nose, and throat doctor, and they did a scope. And that's when they discovered my paralyzed vocal cord. Okay, so while I'm on the subject, what I suspect is they didn't do a tube down my throat, they did a spinal block. And I think possibly when they did the spinal block, it hit a nerve, which then went to my cranial nerve. Yes, I did some research. And I think that's what happened. I mean, still, it's a fluke. I even went to the Mayo Clinic and everything. Anyhow, it was very frustrating. So to continue on, By addressing speech and language barriers, focusing on the issue at hand, and move beyond the why did it happen, still to this day, I don't know. But I focused on strengthening my one functional vocal cord. Speech and language therapy was essential to improve overall communication. So, now we're going to talk about how speech and language therapy helps regaining control. Speech therapy helps individuals express themselves, regain control over their interactions, reduce stress, and foster a sense of accomplishment. How speech therapy helps? Cognitive stimulation. Structured exercises in speech and language therapy can stimulate cognitive functions like memory, problem solving, and concentration, which are vital for mental well being. Improved communication. Speech therapy helps individuals improve their communication skills, which will allow them to participate more fully in life. And then reduce stress. By addressing communication barriers, therapy can reduce stress and frustration associated with a speech disorder and enhance cognitive function. Engaging in structured therapy exercises can stimulate cognitive functions like problem solving, concentration, and memory, which are crucial for mental well being. Increase confidence and accomplishment. Regaining control over your interactions and achieving communication goals fosters a sense of accomplishment and boosts self esteem. Understanding positive and negative thinking. It all resorts back to the subject of mindfulness, what we think. Increase self awareness. When being proactive in expressing thoughts and feelings regarding your frustration with the speech impairment, the opposite of being expressive in the many various challenging life scenarios is stuffing. I will definitely be extremely open regarding stuffing and the negative effects of it. That is why it is important for family and close loved ones to educate yourself so that you have the awareness to the negative effects of stuffing emotions, which is why I'm being so thorough with this live message. For the individual with the challenges, every success you have of expressing your thoughts and feelings, it'll hopefully lessen keeping the thoughts and feelings stuffed. It is so pertinent to break the habit of stuffing your feelings and emotions. What used to take effort, being expressive and not stuffing, you will find calmness and fluidity. I can tell you from experience, it doesn't happen overnight. One who has been on this journey of post trauma growth, there is a protective wall that has been created within yourself. Sharing your mental, emotional challenges feels like being a burden, a nuisance. Even if your family member or close loved one tells you otherwise, your insecurities regarding the physical, mental challenge create the internal imprisonment. And those insecurities which has been instilled within after so many years of stuffing, isolating, such bondage to the negative self-talk. It takes a lot of retraining your inner focus and determination to break the chains of silence, to become more willing to ask for help, to be proactive in getting unstuck from the paralysis of stuffing emotions in order to get yourself out of the quicksand, the black hole of rumination, the tunnel of corrosion and imprisonment, getting out of the entrapment of stinking thinking. You have to take that first step. Take it from me. I know very well all the different imprisonments to ruminating. Rumination involves obsessively replaying negative thoughts, past events, or worries without reaching a resolution, which leads to increased anxiety, depression, and feelings of hopelessness. The more your loved one ruminates, the worse they feel, which then fuels more rumination in a challenging to break cycle. It takes huge effort to get unstuck. It is truly a daily awareness. But the more you verbally express your thoughts, feelings, and emotions, you will notice an improvement in your self awareness. Plus, expressing the mental challenges verbally, the more open you are, you will find calmness and fluidity. That's where, again, I would like to share with the audience that doesn't struggle with mental health issues, communication problems, speech impairments. Support is so helpful. This is a very serious topic and most important to gain awareness of all the different areas that our speech or lack of speech can affect, whether it is positive or negative, is up to not only the individual who has the mental emotional challenge, but also the loved ones in the inner circle. The next, I'm going to move on to self talk. With changing your self talk from negative to positive thinking, it just means that you approach unpleasantness in a more positive and productive way. The self growth will be impeccable. The more you practice expression and self awareness, the easier it'll be. Positive thinking often starts with self talk. Self talk is the endless stream of unspoken thoughts that run through your head. These automatic thoughts can be positive or negative. Some of your self talk comes from logic and reason. Other self talk may arise from misconceptions that you create because of lack of information or expectations, which is due to preconceived ideas of what may happen. If the thoughts that run through your head are mostly negative, your outlook on life is more likely going to be pessimistic. And if your thoughts are mostly positive, you're likely going to be more of an optimist, someone who practices positive thinking. Here's a few quotes that I like. If there is no awareness, there is no change. Aware, accept, action. With awareness comes accountability. And then think, feel, choose. And the last, the more you think about something, the more it will grow. Don't feed the weeds, water the seeds. The health benefits of positive thinking. Researchers continue to explore the effects of positive thinking and optimism on health. Health benefits that positive thinking may provide include increased lifespan, lower rates of depression, lower levels of distress and pain, greater resistance to illnesses, better psychological and physical well-being, better cardiovascular health, and reduced risk of death from cardiovascular disease and stroke, reduced risk of death from cancer, reduced risk of death from respiratory conditions, reduced risk of death from infections, and better coping skills during hardships and times of stress. It is unclear why people who engage in positive thinking experience these health benefits. One theory is that having a positive outlook enables you to cope better with stressful situations, triggers, loneliness, scenarios that are out of your control. If you become successful utilizing coping skills when you find yourself in these most challenging scenarios, it is a good step forward when we succeed. Making a proactive mental choice to not entertain such triggers of emotional trauma that will aid in reducing the harmful health effects of stress on your body. It is also thought that positive and optimistic people tend to live healthier lifestyles. They get more physical activity, follow a healthier diet, and don't smoke or drink alcohol in excess. Identifying negative thinking. Not sure if your self talk is positive or negative. Some common forms of negative self talk include filtering. You magnify the negative aspects of a situation and filter out all the positive ones. For example, you had a great day at work. You completed your tasks ahead of time, and you were complimented for doing a speedy and thorough job. That evening, you end up focusing only on your plan to do even more tasks and forget about the compliments you received. And then the other is personalizing. When something bad occurs, you automatically blame yourself. For example, you hear that an evening out with friends is canceled, and you automatically assume that the change in plans is because no one wanted to be around you. Catastrophize. Canta- catastrophize. Oh my gosh, I'm having a tongue tie. Catastrophizing. You automatically anticipate the worst without any facts that the worst will happen. Example, the drive through coffee shop gets your order wrong, and you think that the rest of your day will be a disaster. Blaming. You try to say someone else is responsible for what happened to you instead of yourself. You avoid being responsible for your thoughts and feelings. And then saying you should do something. You think of all the things you think you should do and blame yourself for not doing them. And magnifying. You make a big deal out of minor problems. Perfectionism. Ooh, that one I kind of relate with. I there's a few OCD things that I can relate with, and I probably would say that there's some challenges with perfectionism for me. That is keeping impossible standards and trying to be more perfect sets yourself up for failure. And lastly, polarizing. You see things only as either good or bad. There is no middle ground. Focusing on positive thinking. You can learn to turn negative thinking into positive thinking. The process is simple, but it does take time and practice. You are creating a new habit after all. The following are some ways to think and behave in a more positive and optimistic way. First, identify areas to change. If you want to become more optimistic and engage in more positive thinking, first identify areas of your life that you usually think negatively about, whether it's work, your daily commute, life changes, or relationship. You can start small by focusing on one area to approach in a more positive way. Be proactive. Think of a positive thought. Begin to manage your stress instead of being quick to go into negativity. Check yourself. Periodically during the day, stop and evaluate what you are thinking. If you find that your thoughts are mainly negative, try to find a way to put a positive spin on them. Be open to humor. Give yourself permission to smile or laugh, especially during difficult times. Seek humor in everyday happenings. When you can laugh at life, you feel less stressed. Follow a healthy lifestyle. Aim to exercise for about 30 minutes on most days of the week. You can also break it up into 5 or 10-minute intervals of time during the day. Exercise can positively affect mood and reduce stress. Follow a healthy diet to fuel your mind and body. Get enough sleep and learn techniques to manage stress. This next one is pretty important. Um, with me living in a building, I am very proactive in focusing on what people I am surrounding myself with. So, this next point is surround yourself with positive people. Make sure those in your life are positive, supportive people that you can depend on to give helpful advice and feedback. Negative people may increase your stress level and make you doubt your ability to manage stress in healthy ways. Practice positive self talk. Start by following one simple rule. Don't say anything to yourself that you wouldn't say to anyone else. Be gentle and encouraging with yourself. If a negative thought enters your mind, evaluate it rationally and respond with affirmations of what is good about you. Think about things you are thankful for in your life. Attitude of gratitude, one of our coping skills. Putting positive thinking into practice. This is a pretty interesting thing that I found. It's going to have the one side of negative thought, and then it's going to have an example for positive thinking. So the first one is I've never done it before. And the opposite of that is it's an opportunity to learn something new. It is too complicated. The opposite, I will tackle it from a different angle. I don't have the resources. The opposite, necessity is the mother of invention. I'm too lazy to get this done. The opposite, I couldn't fit it into my schedule, but I can re examine some priorities. That's a good one. There's no way it will work. The opposite, I can try to make it work. It is too radical of a change. Opposite, let's take a chance. No one bothers to communicate with me. Opposite, I will see if I can open the channels of communication. Lastly, I am not going to get any better at this. The opposite, I'll give it another try. We are actually getting close to wrapping up. Practicing positive thinking every day. This is my ending paragraph. If you tend to have a negative outlook, don't expect to become an optimist overnight. But with practice, eventually your self talk will contain less self criticism and more self acceptance. You may also become less critical of the world around you. When your state of mind is generally optimistic, you are better able to handle everyday stress in a more constructive way. that ability may contribute to the widely observed health benefits of positive thinking. And that is how you can start new beginnings of being healthy and being victorious over the different challenges. One saying that I use a lot for my own encouragement is we can't control what circumstances and situations that happen to us, but we can control how we react to that. That is very, very, very important on this subject with all of the mental challenges from speech impairments. What you feed, what you speak, what you think of, the self-talk. If you need to go over this again and again and again to try to really get it in there. If you have been stuffing for years, it's not just going to happen overnight. I know that, but it's possible. And taking that first step is huge. And I'm telling you, I know from experience, I have been frozen in a state of depression where, I mean, even getting myself to get cleaned up, it's a challenge. So to be speaking, to requesting for support from people, it is hard. You go into isolation. I get it. But I'm talking to you, audience, first, the people who understand the pain of speech impairments. And if you're a family member or a close circle of someone, please be encouraged that to have patience and empathy and validating that loved one, because it is hard, it is challenging. And if you have Jesus living in your heart, that is one way of having a positive in your corner. If you're struggling, Jesus is really huge for a support person. He knows, he catches every tear that we cry. But please, loved ones and close friends, please take it seriously what I shared with you, because it is very, very important. Okay, so I am going to end today's part 2. I am Forever Redeemed. That is my channel, Forever Redeemed. That is number 4, ever, and a capital R on redeemed. And I look forward to preparing my next part, which I think is going to be words that we speak over ourselves. I think that would be a good one. And I think I'm also going to talk in that one about not apologizing all the time, how to change different words. So you are fearfully and wonderfully made. And remember that you are a priceless, rare jewel. You are more precious than a priceless, rare jewel. God loves you. And I will see you on the next live session. It's really exciting, and I'm so glad to be sharing with you all. God bless and take care. Ciao for now.